Hello and welcome to the GBC Newsroom's update on this Saturday evening. The advice from the Director of Public Health has changed on members of the public using masks. Dr. Sohail Bhatti is now recommending people use masks in enclosed areas when social distancing is not possible. At today's COVID-19 briefing by the government, the Health Minister Paul Balban confirmed there are 3 new cases in Gibraltar. And in answer to GBC questions, Dr. Bhatti confirmed that there has been 1 positive case at the Department of Social Security, but said given the time frame involved, there was little chance the virus could have spread on the 400 envelopes delivered to senior citizens in recent days. The government's daily briefing began with an update on COVID-19 statistics delivered by the Health Minister.
I will start by running through today's COVID statistics. As of this morning at 9 a.m, the total number of swabs taken so far was 2,174. There are 113 results pending, and the total results received to date is 2,061. We have a total of 1,859 negative test results, with 136 confirmed cases and 5 active cases, bringing both our confirmed and active cases 3 up from yesterday. We now have 131 recovered cases. In the last 24 hours, there have been a total of 22 attendances to accident and emergency, of which 3 had symptoms that could be related to COVID-19. There were no admissions to either COVID CCU or John Ward, which is our COVID ward, in the last 24 hours.
In answer to GBC questions, the Director of Public Health confirmed that there has been 1 positive case at the Department of Social Security. The department has recently hand-delivered more than 400 pensions and benefits packages to senior citizens who have been unable to collect them because of the lockdown. But Dr. Sohail Bhatti said there was little chance the virus could have spread this way.
This is something we're going to start doing in earnest now. Once we discover positives, we will be doing contact tracing to see whether we can trace everyone that person's been in contact. This will form a very important part of the work we'll be doing in the future. So, I mean, it is quite normal because many of our staff will come across the frontier. There is that inherent risk that we will keep. We will keep the risk there of positive cases coming through undetected. But the next phase now, we will be contact tracing from now on.
So I had a word with the director yesterday about this, and obviously there was a lot of concern. However, it appears that the envelopes with the money in them had been prepared, and the evidence for the virus being able to survive in that setting is limited, and in fact these things won't be distributed till I think Wednesday, so there's little chance of the virus being on the paper and the envelopes. But I would beseech people to move over to having an electronic bank, and to take currency electronically. You cannot catch virus from electronic currency.
In a Saturday briefing which lasted more than 50 minutes, Dr. Bhatti updated his advice regarding the use of masks. He's now recommending people use masks in enclosed areas when social distancing is not possible.
We've reviewed this very carefully, and there still seems to be a mixed degree of evidence about the benefit of masks. But I think I've been persuaded, we've spoken to the World Health Organization advisors, we think that there's sufficient evidence now to suggest that because there's asymptomatic carriage, that means that people are carrying the virus, don't know they're carrying the virus, have perhaps no symptoms but are spreading it, that one of the best ways that we can prevent that is by wearing a mask. But I'm not talking about everybody wearing a mask all the time, everywhere. There is no evidence that anyone has caught the virus, or very little evidence, in fact, that anyone has caught the virus outdoors. So I'm not saying that people need to wear masks as they walk down Main Street or any public setting. But what I am saying is that when we come into enclosed areas where you cannot maintain social distance of 2 meters, then it's reasonable for you to wear a mask to protect your neighbour and the other customers.
The Health Minister asked people to eat as healthily as possible and make sure they're doing some exercise. Paul Balban said that obesity increases the risks associated with testing positive for COVID-19.
One thing that's been receiving a lot of attention in medical press recently, and is something very close to my heart, is that of obesity and its links to COVID. Being obese greatly increases the risk of complications associated with COVID-19. While we are spending more time at home, we need to look after ourselves and take care of what we eat. With grandchildren not coming around to visit, there is no need to have that chocolate and sweetie drawer, which we will eventually tuck into ourselves anyway. We should try to use our time positively while we are in lockdown to try to plan our diets, cook and eat healthier alternatives.
The Director of Public Health said he didn't think enough swabbing was being done and gave some details of the random testing that will be carried out among frontline workers.
I don't think we're doing enough swabbing. It's taken us an awful long time to collect the swabs that we have. We need to use them and use them wisely so that we can, if you like, driving in the dark, you switch your headlights on. The swabs and the results from those swabs are our headlights. It's important we have enough. So what we're also going to do is offer swabs to our frontline workers. We'll start with the government frontline workers, but I've absolutely no issue about extending that to other frontline workers such as home delivery services and supermarkets. But we really want to start with the Borders and Coast Guard Agency. We need to start with the RGP, the airline, AirJib. We also obviously need to target the GHA, the staff in that, particularly the ones that are in close contact with patients, the ERS, care agency. We're going to do some major, we're going to do a sweep in the prison service because that's a contained unit where it could spread very rapidly. So you will see us out and about in a rolling programme of swabbing. And I should say that given the fact that teachers are also in a setting, we will include teachers in this swabbing programme.
And he warned that while the curve may have been flattened for now, Gibraltar will still get sporadic incursions by land, sea and air. It's a seek and destroy mission, said Dr. Barty. That's the only way Gibraltar can find its way out of the lockdown. He said because of how densely we live in this community, he remains steadfast in his outlook that most of us will get the virus eventually.
The virus is still there. So I think the problem is that when we do loosen the lockdown, we also, and remember the lockdown has been the bit that's been responsible for stamping out the curve, that may just be enough of a spark, or the next spark that lands on this lovely tree that is Gibraltar, it would catch fire. That's why I have a lump in this throat.
The Director of Public Health said his message is consistent with the Chief Minister's. The virus is still out there and there's no room for complacency. Dr. Barty also said he cannot remember a recommendation of his that the government has not seriously looked at and debated. He said Gibraltar is really lucky to have the quality of politicians it has.
Gibraltar's really lucky to have the quality of the politicians it does have. And that's shown in the fact that people put the interests of Gibraltar ahead of their own petty political interests. And they've stood in front of us and said exactly that. And I would bear that out. So as far as scientific advice and medical and clinical advice, public health advice, I've not got any reason to complain. I think it's just praise, actually.
Mr. Balban said there have been more than 4,900 calls to the GHA's 111 call centre and a further 1,500 online submissions. The GHA will mark Workers' Memorial Day with a minute's silence on Tuesday at midday for the NHS healthcare workers who've lost their lives to this new virus. Quite a lot to chew on from today's COVID-19 briefing, delivered by Health Minister Paul Balban and Director of Public Health Dr. Sohail Barty. Meanwhile, the Commander British Forces Gibraltar has confirmed that Forces personnel will be included in the random testing of frontline workers. Commodore Tim Henry also said Forces personnel will be involved in the GHA's contact tracing team.
And here in Gibraltar, we will also be part of the Government of Gibraltar's random testing regime, where service personnel and civilians from across British Forces Gibraltar will be invited to participate. We're going to help with the contact tracing that will be necessary, such that if anyone does have COVID and is found to have COVID, they're able to be traced and we're able to work out who they've been in touch with. So as the weather improves, and that is coming, and as the work continues to get us out of lockdown, remember what this is about. Remember that this is about keeping our most vulnerable safe.
In other news, Dudley Ward Tunnel has again closed in both directions until further notice. It follows yesterday's incident in which a truck carrying supplies to the field hospital at Europa Point got stuck on its way through. The police have asked the public to please avoid the area if possible. And the community effort to raise money for healthcare workers to fight the coronavirus continues, with the Gibraltar Ivanhoe Society donating 10 medical oxygen regulators to the Health Authority to use in their COVID-19 ward. Meanwhile, Health Minister Paul Balban today confirmed an impressive total of £1.63 million has been donated so far by 128 donors. Well, before we go tonight, a reminder of the main points from today's COVID-19 briefing. The advice from the Director of Public Health on members of the public using masks has changed. Dr. Sohail Bhatti is now recommending people use masks in enclosed areas when social distancing is not possible. The Health Minister Paul Balban said there are 3 new cases in Gibraltar. And in answer to GBC questions, Dr. Bhatti confirmed that there has been 1 positive case at the Department of Social Security, but said, given the time frame involved, there was little chance the virus could have spread on the 400 envelopes delivered to senior citizens in recent days. That's all from the news team. We'll be back at the same time tomorrow. Good night.